Caduet tablets contains two medications, amlodipine and atorvastatin. Amlodipine is a calcium channel blocker and is used to treat high blood pressure or prevent chest pain, angina. It works by relaxing the blood vessels so that blood can flow more easily and the heart does not need to work so hard. Lowering high blood pressure helps prevent strokes, heart attacks and kidney problems. Preventing chest pain can help your ability to exercise. Atorvastatin is used along with a proper diet to help lower bad cholesterol and fats, such as LDL, triglycerides, and raise good cholesterol HDL in the blood. It belongs to a group of drugs known as statins. It works by reducing the amount of cholesterol made by the liver. Lowering bad cholesterol and triglycerides and rising good cholesterol decreases the risk of heart disease and helps prevent strokes and heart attacks. In addition to eating a proper diet, such as a low cholesterol or fat diet, other lifestyle changes that may help this medication work better, including exercising, losing weight if overweight, and stopping smoking. Consult a doctor for more details. Indications: Caduet is used to treat high blood pressure, hypertension or chest pain, angina, and to lower the risk of stroke, heart attack, and other heart complications in people with type 2 diabetes, coronary heart disease, or other risk factors. How to take? Caduet is taken once a day. Your doctor will decide which strength is suitable for you. This will depend on your blood pressure, cholesterol, and triglyceride levels. Your doctor may need to adjust your dose after your blood pressure and the fat levels in your blood have been checked. It is important that you keep your appointments to have this test done. Swallow the tablet whole with a full glass of water. Do not chew or crush the tablets. Initial dose: amlodipine 5 mg, atorvastatin 10 to 20 mg orally once a day. Maximum dose: amlodipine 10 mg, atorvastatin 80 mg orally once a day. Small adults, fragile or elderly patients may be started on amlodipine 2.5 mg orally once a day. Most coronary artery disease patients will require amlodipine 10 mg orally once a day for adequate effect. Patients who require greater than 45% low-density lipoprotein reduction may be started on atorvastatin 40 mg orally once a day. May be titrated for amlodipine after 1 to 2 weeks and for atorvastatin after 2 to 4 weeks. Atorvastatin has not been studied in conditions where the major lipoprotein abnormality is elevation of chylomicrons. Contraindications: Do not take Caduet if you have an allergy to any medicine containing amlodipine, any of the ingredients. Some of the symptoms of an allergic reaction may include shortness of breath, wheezing or difficulty breathing, swelling of the face, lips, tongue, or other parts of the body, rash, itching, or hives on the skin. Warnings: You should not use Caduet if you have liver disease. Amlodipine and atorvastatin can harm an unborn baby or cause birth defects. Don't use if you are pregnant. If you become pregnant, stop taking this medicine and tell a doctor right away. Do not breastfeed while taking Caduet. Before taking Caduet, tell a doctor if you have ever had liver or kidney disease, heart disease, diabetes, or a thyroid disorder, or if you drink more than 2 alcoholic beverages daily. In rare cases, Caduet can cause a condition that results in the breakdown of skeletal muscle tissue, leading to kidney failure. This condition may be more likely to occur in older adults and in people who have kidney disease or poorly controlled hypothyroidism, underactive thyroid. What to avoid? If you also take nitroglycerin for chest pain, do not stop taking it while taking Caduet. Avoid eating foods high in fat or cholesterol, or Caduet will not be as effective. Avoid drinking alcohol, it can raise triglyceride levels and increase your risk of liver damage. Alcohol can also increase some of the side effects of Caduet. Grapefruit may interact with this medicine and lead to unwanted side effects. Avoid the use of grapefruit products. Caduet side effects: Get emergency medical help if you have signs of an allergic reaction to Caduet, hives, difficulty breathing, swelling of your face, lips, tongue, or throat. In rare cases, atorvastatin can cause a condition that results in the breakdown of skeletal muscle tissue, leading to kidney failure. Call a doctor right away if you have unexplained muscle pain, tiredness, or weakness, especially if you also have fever, unusual tiredness, or dark-colored urine. Call a doctor at once if you have muscle stiffness, tremors, abnormal muscle movements, muscle weakness in your hips, shoulders, neck, and back, trouble lifting in your arms, trouble climbing or standing, severe drowsiness, feeling like you might pass out, worsening chest pain or chest pain spreading to the arm or jaw, nausea, sweating, general ill feeling, liver problems, upper stomach pain, loss of appetite, tiredness, dark urine, jaundice, yellowing of the skin or eyes. Common Caduet side effects may include muscle or joint pain, diarrhea, nausea, upper stomach or swelling in your legs or ankles.